Hello everyone, my name is Lee Suge, student nurse from CU Manila, and I'm here to present the pathophysiology of polycythemia. So what is polycythemia? Polycythemia is the increase in the number of red blood cells. The condition results from the increased erythropoiesis, which is a compensatory response to insufficient oxygenation to supply oxygens into our body cells. So, predisposing factors can be the patient had suffered from low oxygen content, heart failure, hypoxemia, pulmonary disease, um, hemoglobin abnormalities, water deprivation, gastrointestinal losses, and then excess use of diuretics. So the first event that happened in the pathophysiology of polycythemia is when the mutation of hematopoietic stem cells, or what we call the JAK2 kinase, this JAK2 kinase is a protein which is responsible for the growth and the division of our body cells. So usually, our kidney secretes erythropoietin that signals the bone marrow to produce more red blood cells. But in the pathophysiology of polycythemia, even with the absence of erythropoietin, the bone marrow still produces red blood cells, which this happens when a hormone binds into a stem cell. which activates the JAK2 kinase. And then signals the bone marrow to produce more red blood cells. The next thing happens is that there is there's a protuberant hematopoietic stem cells which give rise to these myeloid stem cells contains 5 granulocytes. They are namely monocyte, basophil, eosinophil, neutrophil, and mast cells. So in polycythemia, basophil and mast cells increase and produce in the release of histamine, which the patient may suffer from itchiness. And there's a signal to release red blood cell from the bone marrow, increase RBC, production occurs. In increased red blood cell production, the patient may suffer from splenomegaly, hepatomegaly, gout, and thrombotic events. After this, there will be an elevation of hemoglobin and hematocrit. That will soon lead to vessel congestion due to the plenty red blood cells present in our bloodstream. Then later on, it increases blood viscosity. In here, predisposed individual will suffer from blood clot. Eventually, when these cells die, there will be a scar in tissue formation, which will make the bone marrow incapable of making red blood cells. So when cell dies, scar tissue formation. Making the bone marrow incapable of making RBC. When the bone marrow can no longer produce blood cells, the patient may suffer from anemia, thrombocytopenia, and leukopenia, or what we call myelofibrosis. Anemia, thrombocytopenia, and leukopenia. Or what we call myelofibrosis. Signs and symptoms of polycythemia includes plethora, fatigue, dizziness, itchiness, increased sweating, redness in the face, and blurred vision. So this is the pathophysiology of polycythemia. I hope you learned something and thank you for listening.